Your dentures shouldn't wiggle or move or rub or cause you pain, so why are you putting up with that? If your smile looks fine to other people, but you know it doesn't feel right, it's time to fix that situation. Let's break down why poor fitting dentures happen, what to do about it, and what your options are. Here at Dental Implant and Aesthetic Specialists, one of the things we do day in and day out is deal with dentures. Let's talk about why they can fit incorrectly and not feel right. The denture itself may have been well made, but there are lots of things that can cause it to not fit properly over time. The main cause of a denture not fitting well over time is bone and tissue change. This is a natural occurrence in the body, especially with the lower jaw. It resorbs about 4 times faster than the upper jaw. But as that bone and tissue shrinks and remodels, you're no longer going to have that intimate contact between the inside of the denture and your tissue and bone. The next factor is just wear and tear of the material. It's a plastic material that's not designed to last more than 15 to 20 years, and the mouth is a harsh environment. So whether that's wear and tear on the teeth themselves or breakdown on the inside of the denture where it comes in contact with your gum and bone. You could have changes in your bite, and even small shifts in how those teeth come together could have an impact on your bite. When I say small, we're literally talking millimeters of difference. Something that tiny can impact the whole mouth and the whole arch. Sometimes teeth that aren't built correctly or a denture that doesn't fit ideally can cause problems over the long term. This is why it's absolutely crucial for you to speak up during the making of your denture. If it doesn't feel right, it doesn't feel correct, you need to let your dental provider know so we can walk you through the problem and make it right. And the final sign is if you're using a ton of dental adhesive, you should not be going through a tube of adhesive every day. If you're having to use that much just to get the denture to stay in place, that means there's a lot of space between the inside of the denture and your gum tissue that you're trying to fill with that adhesive, and it's time to start over with a new denture. Here are some signs that I see in my patients that I'd like you to be on the lookout for. There might be time for an adjustment, a reline, or a new denture. Constant trapping of large amounts of food underneath the denture to the point where you have to take it out and clean it out every time after you eat is a sign that something's not fitting properly. And by large amounts, I mean like a whole sandwich. You should not be fishing large pieces of food out. Unfortunately, the nature of dentures is that they rely on the junction between movable tissue and hard tissue, so inevitably you're going to have some micro gaps where food can sneak under there. But if you're getting large particles of food to the point where you really have to clean them out after everything you eat, you might need to come see us for an adjustment. If the denture is slipping or moving while you're chewing and talking, or heaven forbid comes out of your mouth while you're doing those actions, it's time for us to make a correction. The final sign is if you've just given up on your denture and they live in your drawer. If you're to the point where you can't wear them or use them, we've got to fix that. Your mouth is telling you something and it's time to listen. Let us help you out. Here's how we address those solutions at Dental Implant and Aesthetic Specialists of Atlanta. It all starts with a comprehensive evaluation where we look at the bone levels, the tissue levels, the gum health, the bite, the wear, and the degree of breakdown of the existing denture. The first thing we look for to address the situation is just to see if it's something as simple as a minor adjustment. A lot of times a well-fitting denture can have 1 or 2 little areas that are overextended and the tissue is just not happy. And at that point, we can really just adjust back and get the denture back to nice, healthy harmony with your mouth. When you think about a denture, there's basically 2 services. There's the teeth side and the inside. Sometimes if the inside fits great and everything is in good shape, but the teeth are really worn, we can just replace the teeth. Sometimes if the teeth are great and the inside just needs to be relined, we can modify that. Unfortunately, a lot of times it's to the point where the teeth are worn and it no longer fits correctly, and at that point we have to make a new denture. If we determine that your existing denture needs to be replaced, one option that we have is to go down the road of implants and give you a treatment plan that involves teeth that attach to those implants and stay in your mouth. Making you a new denture is a very customized process. It starts with custom trays and impressions so we can capture exactly how your tissue and bone is, so when we make this new denture, it's fit very snug and accurate to how your tissue is now. Part of the process of making a new denture, and it's one of my favorite parts, is selecting the teeth. What's really cool about starting with a new denture from scratch is that we can pick the tooth shape, size, color, location, and make it very custom and specific to you. Something that we do here at our practice is we actively involve our patients in that process. A lot of times it starts with photographs of yourself when you were younger, if you had a gap in between the teeth, if you had kind of short teeth. These are all things that we can recreate in your new denture. A lot of times we'll ask patients to bring in photos of themselves, or if they have photos of a celebrity or something they see in a newspaper or a magazine that they really like. We love seeing those because it helps us create a smile that you are a part of creating, and it shows your personality. You'd be amazed at how many tooth options we have, from coffee stained to bright white, from really sharp, from really curvy. It's amazing just the options we have, and I like getting patients involved in that process because it really does become a customized thing. And when we give you your new teeth, we want you to be happy with that smile. We want you to feel like they're your teeth. We don't want you to feel like they're just a stock set of teeth that everybody has. Poor fitting dentures aren't just something to live with. After all, you wouldn't just wear shoes every day that hurt your feet, so why would you do that for your mouth? If your denture is painful, moving around, or frustrating, let's fix it. At Dental Implant and Aesthetic Specialist of Atlanta, we specialize in not only making your smile look great, but making your teeth feel great. Please schedule your appointment with us today by clicking on the link below. I'm Dr. Brett Langston. I'm here to help you watch your mouth.
Down in Brookhaven, with a smile shining bright, Dr. Brett Langston's working late into the night. With hands steady and a gaze so keen, he's the best on pots, the dumbest you've ever seen.